Hello, my name is Dwight Phillip with Phillip Financial, and I represent your employer, Fantastic Sam's. What we're doing today is talking about the employee benefits being offered to you by your employer. We are going to be going with two plans with Florida Blue. They're both going to be PPOs, so you will not have to worry about picking a primary care doctor, and nor will you have to worry about getting a referral to go to a specialist. The network is national. And before I get going on it, I'd like to invite you to go to floridablue.com. This is where you can go look up your providers, which the network is called Blue Options for both plans. And of course, if you guys need any help, anything like that, you just reach out to us and we'll be more than happy to assist you. Also, while you're on that Florida Blue website, what you take a few minutes and just cruise around through there, look at all the additional benefits available to you by being a Florida Blue member, which I'll go over at the very end of this video. But with that also being said, you'll also find the teledoc feature, which will give you a real-time FaceTime conversation with a doctor 24/7 that can prescribe. So with that being said, I would encourage you to go there. If you're having difficulty, you just reach out to us at 239-461-0001 and we'll be more than happy to assist you. All right, so to jump into the actual plans, we're going to be maintaining Transamerica, also adding another element of trans to make it more affordable. And then as we go through, I'll be going through the coverages and how trans is interacting with it. So as you look at the very first plan, you're going to see plan 5910. This is plan's going to have a $30 primary care copay and a $55 specialist copay. Now, when you look at the next plan, 5908, the way this one works is that the first 3 visits, no cost to a primary. And then on your 4th visit is where you would have a $30 copay. The specialist copay on this one is $60. So, with that being said, now both plans will have the adult wellness feature. So for all your well woman, well child mammograms, colonoscopies over the age of 50, prostate exams over the age of 40, they're free. So those don't count with the second plan with the first 3 visits. So with that being said, it's a very robust plan, and you should have no issues working with it. Now, remember, if you're at the doctor and they poke, insert, cut, do EKG, MRIs, X-rays, CAT scans, then if you have Transamerica, you want to show that card, because what that's going to do is pick up any additional copays or deductible that may come your way. So some examples of that would be go to the dermatologist. They want to freeze, zap, cut, burn. You pay the specialist copay, show the trans card. Trans will pay that cutting part for you. Or you go to ENT and they want to run a nasal scope, see what's going on with you. That scope's about $1,800. So again, you pay that specialist copay depending on the plan that you're on. Show that trans card and it'll pick it all up for you. So that's basically, so if you're not sure, you can either do 2 things. You can call my office and we can tell you, show that card, this is what you're going in for. Or if you're just not sure, you just show both cards and we'll take it from there. So, and also if you're at the doctor's office and they're looking at you, they're not understanding, what trans is doing and all that, you can pause, call us. We'll be more than happy to assist you while you're there. We can talk to the provider and walk them through the steps, so that way it's an easier transition, as well as upcoming surgeries or diagnostic testing. We set you up before you show up. So please just reach out to us. We want to see you maximize your plan. As we go a little further, you'll see with MRIs and CAT scans on the first plan, that's all going to be a part of your deductible. In addition to that, if you look at the next plan, you're going to see a $60 copay for X-ray. But again, if you have Transamerica, it's going to wipe all that stuff out. Just like with the MRIs and CAT scans, Tran's going to come in and pick that up. Now, the real main difference between the first and the second plan is the first plan is a generic plan with name brand only coverage. So if you take a generic and name brand drugs, the first plan is going to work very well. But if you take a non-formulary or specialty drug, then that's where the second plan is going to come in. And then you'll see that all broken down for you at $10, $50, $80, as well as a $250 copay for your specialist. So 10 generic, 50 name brand, 80 non-formulary, 250 specialty. On the first plan, when it comes to name brand, you just pay 20% of the bill. So if the bill's $100, you pay 20. If it's 200, you pay 40. But the good news is the worst you'll ever pay is 200 in one given month. So it's a very good plan if you're on generics and name brand. So keep that in mind. And if you're not sure, you just reach out and call us and we'll be more than happy to help you. When it comes to same-day surgery, emergency room, with both plans, that's all going to follow under your deductible and your out-of-pocket. If you have Transamerica, Trans is going to come in and pick that stuff up to the benefit amount that you pick. So the new feature we're showing this year is $1,500, which is better than nothing. $3,500, which is middle of the road, and then $8,500, which will get you almost there depending on the plan that you pick. If you pick the first plan, your worst case answer with the $8,500 is that you'll have a $600 exposure. But if you have the $8,500 and you're on the second plan, you'll have no exposure if you go to the hospital, ER, same-day surgery, maternity, things of that nature. I mean, it's going to take care of the whole thing for you. As we go a little further, when it comes to your blood work is done with Quest. So make sure that you tell your provider Quest is who you use, and Quest will come pick your blood up and you'll get the results back fairly quickly. In addition to that, if you are going to an urgent care, you're going to see a $60 copay and a $100 copay depending on the plan that you have. If you do have Trans will cover that, but keep in mind with adults only, colds and flus are not considered urgent, only with children. So Trans would not work in that category, but Trans would work for the children as well. So, but if you do have that cold or flu, do the teledoc. You pay nothing for the service and they can prescribe. It's convenient. You can do it from home. You can do it from work. So it's a very convenient tool to actually use. As we go a little further, if you are in the hospital, on both plans, deductible and out-of-pocket, again, depending on the level of Trans that you have, Trans will come in and pick that up. When it comes to mental counseling as well as therapy, there is no cost for in-person visits with Blue Cross, and that's regardless of what plan that you pick. So keep that in mind. If you need to talk to someone or you need help, you can do that in person, no cost associated with it. If you do need to be confined, regardless if it's mental or detox, there is no cost associated with that, and you're good for 30 days. And if you're just not sure, just please reach out to us. We'll be more than happy to assist you and make sure that you're using the benefits correctly. Now, when we get to the maternity side of it, maternity is a one-time specialist copay. Now, if you're on the first plan and you have the $8,500 Trans, there would be a $600 discrepancy at the end for you to have your child. If you're on the second plan and you're expecting and you have the $8,500, it's going to come in and wipe that out of pocket away for you. Also keep in mind, you only pay one copay on the prenatal. The only reason why you pay additional copays is if you're having complications of prenatal. So with that being said, that would be the only reason. And if you're not sure, again, just reach out to us and we'll get everything pointed in the right direction for you. When we go a little further to also go more in detail, if you do have Transamerica, Trans will cover allergy injections, sleep study. You'll also cover your CPAP or all durable medical equipment. You'll also cover infusion therapy, radiation chemotherapy, all hospitalizations, all same-day surgery, emergency room, all testing, urgent care. So it really covers a lot of stuff, and really the whole point of the trans is to protect you from financial hardship because of medical use. And what it does is that it's just there to help you be proactive with your health care instead of reactive, so that way you're getting to the doctor sooner than later, and that later could be a bigger deal, a bigger bill, going on down the road. So that's really what trans is there for. It is to encourage you to go and not be worried about the big things that are there. In addition to that, trans will also cover chiropractic care and physical therapy up to $1,000 for both those benefits. So it will help with those copays. So just keep that in mind. And then as you see on the first plan, you'll see that you have yourself a $5,000 deductible with a $9,100 out of pocket. So that's where that $8,500, you have that discrepancy. But on the next plan, it's a $5,000 deductible with a total out of pocket of $8,200. And that's where that $8,500 would come in and pick that up. But again, $1,500 is better than nothing. $3,500 is better than nothing. So it's all about what you can afford, and that's why we're throwing that third one in there. So that way, at least you got something to help you with your deductible as we go through. Now, again, if you do have any problems, concerns, you're not sure, any upcoming surgeries, please reach out to my office, 239-461-0001. If you get bills in the mail, you're not sure what you should pay, it's not matching what I'm saying, then you just call my office. We'll do the filings for you and all the stuff, and we'll, again, get you pointed in the right areas. So as we go a little further, we are going to maintain the two Humana dental plans. The first one is the PPO. There is no change in how the coverage works. It's still unlimited, so you cannot exhaust this dental plan. You go to humana.com to access the providers. For the PPO, it's called Traditional Network. And then in a minute, I'll tell you about the HMO. As we go a little further, you still get 2 free cleanings a year, which include your bite wing, x-ray, fluoride treatment for kids that are 14 and down, oral check for all, and cancer screening for those that are 40 and over. So no cost. But if you do have to go 3 or 4 times a year for your cleanings, make sure your dentist knows that it's going to be covered under the basic, under a deep root scaling, meaning periodontal. So it's a $50 deductible. They pay $90, you pay $10. You go out in network, they pay $80, you pay $20. Also in that basic category is where your oral surgery, tooth extraction, fillings, root canals, gum scrapings all fall in that same category. So $50 deductible one time, they pay $90, you pay $10. You go out in network, they pay $80, you pay $20. In the major category, this is where your dentures, bridges, inlays, onlays, crowns all fall here. So after a one-time $50 deductible for the year, they'll pay $60, you pay $40. And if you go out of network, they pay half, you pay half. So we're clear, your plan with the Humana PPO Dental is very robust. So if you go out in network, it is working at the 90th percentile, which means 90% of all dentists in this area will charge this amount for this code. So even if your dentist doesn't take Humana, that's okay. We'll either file that for you or they'll file it for you as well. Either way, we can make sure it works. But what you can do is you can do what we call a predetermined cost sheet, which if you send that to us, we can then verify what your financial exposure is before you even commit and sit in that chair. So please keep that in mind, that you can really reach out to us on these services. That's what we're here for, just to see the plans work better for you. And then of course, there are no waiting periods if you're new to the plan, and that's the PPO dental plan. Now to shift gears, we're going to still stay with Humana Dental, but now we're going to look at the DHMO, or the dental HMO plan. Now on this one, you do have to pick a primary care dentist. You can change that dentist every month. The DHMO is not a bad plan, but you cannot go to anybody. The network is smaller, but it is pocketbook friendly and it's user friendly. So like for example, if you need a crown on this one, you're only paying $245, but a lot of people like it because of the orthodontia, because you can do the adults or the children on this one. And the way this works is that you pay a total of $18.50, and that's for the full metal, everything. So usually what people do with kids is they'll come off the PPO, go on to the HMO for a couple years. When the braces are done, then they go back to the PPO. So that's really a good driver, and it's also, again, user friendly, pocketbook friendly. So it's just, you don't have a big, huge choice of network to choose from like you do with the PPO dental plan. So just keep that in mind. There are no waiting periods in it. And then when you look at it, you're gonna see about 5 pages full of a bunch of numbers on one side, what it costs you on the other side. Those are your codes. So if my advice is when you go to the dentist, you bring this with you. So that way upon checkout, they're gonna give you the codes on the bill. You can look at the code, make sure that they're charging you right. And if you feel like they're not, you can always send it to us and we can verify everything as well. Okay? So to now move on, we're also going to maintain a Humana Vision plan. Now, so we're clear, if you don't wear glasses or contacts, you do not need the vision plan. Having like glaucoma of the eye, hypertension of the eye, cataracts of the eye, that's all health insurance. That's all going to be Blue Cross and Trans. So you don't even have to worry about that. This is maintenance of the eyes. The way it still works is $10 copay for the eye exam, $15 copay for the contact lens or frame. Now, the way we built it is that you can get contacts, lens, and frames every 12 months, but what you cannot do is get glasses and contacts in the same year. So what most people do is get glasses and frames first, contacts for a couple years, and back to glasses again. But you'll notice when you look on the schedule that you have the ability to customize your glasses and your contacts. So if you're that person that wears progressives that are transitionals with stylish frames, you would expect to pay anywhere from $180 to $200, but you just walked out with a $700 pair of glasses. So you can definitely customize this. And if you're not sure, just reach out to us and we'll be more than happy to assist you. Also on this one, I would strongly encourage you to stay in network. There are a lot of optometrists as well as opticians in there. You got a really big network to choose from. Try and stay in network so that way you are protected by the contractual language. And it's also going to be cheaper for you if you do it that way. And if you can't find a list or anything, just reach out to the office, 239-461-0001, and we'll be more than happy to help you. Now, on the second page of that, if you go and you look at the second page, you'll see that if you're a diabetic, that you get a lot of additional free services associated with that eye exam. So please take advantage with that. And to also shift gears a little bit back to the health and the trans, that if you are a diabetic and you're on a pump and a sensor, trans pays all that stuff. And also Blue Cross is very diabetic friendly. So please keep that in mind. And if you're not sure, you do have a mail order program inside Blue Cross. Please take advantage of that because you're saving money throughout the whole year. And if you need help setting that up, we will help you set that up online. So just call the office to say you need help and we'll walk you through. In addition to that, you're going to see on the portal this one-page cheat sheet. Now, what this is showing you all the benefits available at Florida Blue just by being a member. So you'll see they have hearing and vision, they have home and family nutrition, they have gym deals, they have all kinds of stuff. They even have a diet program, prenatal program. They even have a personal nurse. They even do personal coaching. So please take advantage of this thing. It's all available to you at no cost. It is all discounted based on what you need. They even have acupuncture, they have yoga. So really, you got a lot of tools, a lot of things out there for you. So don't be afraid to look, ask, and that's what we're here for. So again, if you have any problems, concerns, you're not sure, upcoming surgery, get a bill in the mail, you know, it just doesn't look right, you just call 239-461-0001. We'll be more than happy to help you. Thank you all for your time, and please stay safe out there.